Hi, everybody. My name is Mary Maida. I am a director of Canine Cancer Alliance. Director is a lofty name. I'm a volunteer. I've been working on this for 6 or 7 years after losing all our golden retrievers to cancer, all three of them, osteosarcoma, hemangiosarcoma, and soft tissue sarcoma. I was just so frustrated with today's treatments. And I knew there were researchers out there with promising therapies. They just had to, I thought, be supported. So I started fundraising and to try to support research and clinical trials. We're so grateful to Professor Mark Mamula for inventing this new therapy. Not just that, but actually starting clinical trials and starting a company to get approval from the USDA, which is not an easy thing to do, and do it in a way that's hopefully the therapy will become available many more dogs, all the dogs in the U.S. and perhaps other parts of the world as well. And what impressed me so much about Mark is that he's not only trying to prove and show that this therapy is safe and could work to help some dogs, but also exploring ways to make it even better. So he's partnering with other researchers and clinics to try to make the therapy more effective so more dogs can respond, not just 65% or whatever, but more dogs will respond. And I think he's also looking to see if gut microbiome has something to do with immunotherapy response rates. And so he's really exploring to see how he can make it better so he can cure every dog who gets these solid tumors with cancer. So we're just so impressed and just so grateful to Professor Mamula for the work that he's doing. And I also want to mention that this work is made possible by generous donations from Jordan Katzman, Corwin Mallet, Shelley Gregory and Tom Erickson, Michelle Wolf, Jeremy Thurswell, and so many of you who have donated and run fundraisers to make this treatment possible, clinical trial possible. And if you would like to support this research, another way to do it is to join our calendar. We have this beautiful calendar that we're making for 2025. This is from 2024. And every day of the calendar will have a picture of a dog on it. And it could be a cat too, any animals, not humans. But if you'd like to learn more about the calendar, it makes a great holiday gift. You can make a donation, and I dropped the link at the very top of the chat room so that you can find out more about the calendar. So this is one of the ways that we're raising funds to support Professor Mamula's research. And before I let Mark start speaking, I would like to introduce Delisa, who's Kaiser's mom. Kaiser is right now, he was diagnosed with bone cancer, and I will let Delisa share their story.
So I'll try to go through a brief timeline. This is my dog Kaiser. He's 8 years old. We adopted him from the Humane Society when he was 2. Kaiser started off in June of last year with a small, he wants treats. He started with a small bump right here on his skull. You can see that's the primary osteosarcoma tumor. And the vet initially thought it was a bee sting. And we started to notice it was growing. And then we requested an x-ray, and that it was determined in June 2023 that it probably was a cancerous tumor. In July, he had a biopsy that clarified that it was, or confirmed it was osteosarcoma. In August, we took him to Texas A&M Small Animal Hospital in College Station, Texas. We live near Austin, so that was the closest and the most recommended place for us to take him. He had a CT scan also confirming he had osteosarcoma and multiple lung mets that were very microscopic. Then they told me basically there wasn't anything they could do. He had about 2 to 3 months. Surgery wasn't an option due to the location of his tumor. I'm a registered nurse. I was like, I'm not accepting that answer. I know modern medicine has come a long way. I went and joined multiple groups on Facebook. I posted in many cancer groups, and I came across a woman named Sherry Harvey, whose dog had received the Yale vaccines, and she referred me to the Canine Osteosarcoma vaccine group. And that's when we started the process of trying to get Kaiser into the trial study. In August of 2023, he got his first vaccine at Integrated Veterinary Oncology in Phoenix, Arizona, with Dr. Hershey. And then in September, he did receive stereotactic radiation to his skull tumor. And then in the end of September, he received the second vaccine. And then we went back another time in October of last year to get blood work at IVO. In November of 2023, his x-rays were still clear. And then in February of this year, unfortunately, his lung tumors were showing up on x-ray. However, I knew there was a booster available. So in June of this year, we went back to Integrated Veterinary Oncology in Phoenix, and we had his booster for the Yale vaccine. And they have grown since then. But as of August, they've stayed consistent in size. And he has not had any signs or symptoms of cancer. Given 2 to 3 months last June to being alive now, I truly believe that the vaccine is the reason why he's still with us today. He is now on a low dose of oral chemo. We do give him daily fenbendazole, which has shown to have some anti-cancer properties. I'm not sure the significance of it, but it works for him. And we give him milk thistle, and we feed him a high-protein dry kibble. But he is his usual self, unless, of course, we're on a Zoom, then he is trying to be sleepy. But we are very grateful for the vaccine. I try to share it with as many people as I want, because I know that feeling of, thinking that you're defeated, that it's a death sentence. And this vaccine has already changed so many lives, and it's going to change so many lives in the future. So we're very proud to be a part of this. And we're very thankful to Dr. Mamula for, creating this vaccine. And I've enjoyed all the extra time we have with Kaiser. So we're truly thankful for that. And he continues to do well. He's very happy.
What a great story. That is terrific.
Yeah, and all his vets and oncologists, we still see Dr. Hershey. We do telephone consults. They're just amazed. His lungs sound great. He doesn't show any signs of slowing down. He's very active. His appetite's still the same. And they all just are amazed by how he's doing today.
So you and I have to speak a bit or exchange emails offline here. Dr. Hershey is terrific, but sometimes she's difficult to get things like copies of radiographs, x-rays from, and things like that. So we'd like to document your story more carefully for our records, of course, and which we do for everybody in our trial as closely as we can. But sometimes the trial sites aren't they're understaffed and they're overworked, understandably. And so what a terrific story, though. That's thrilling.
Yeah, thank you. We're so, like I said, we're really grateful to you, and Kaiser means so much to us, and we love him so much. So we're just excited to share his story. And I'm always amazed at how many people have never heard about this vaccine. I was one of those people initially. So I'm just happy to share the word and give people hope, and just continue helping our dogs live their full life. Right?
Oh, that's terrific.
Thank you again.
You're muted, Mary.
How many hours was it each time you visited IVO from?
15 hours each way, and we did the trip 4 times round trip.
Oh my gosh.
And you drive a Tesla, right?
We got a Tesla in the beginning. We had a Subaru. So the Tesla was a lot more stops, but we had a Subaru for the first 3 trips.
Wow.
Awesome.
And if anyone's interested in following Kaiser, he does have a pretty good following on TikTok. He's GoodestBoyKaiser, which is my screen name on here. And we just like to share, all aspects of this journey, the good and the bad, and just keep it real for everyone who's going through this. And, you always feel free to message me. I'm always willing to help as much as I can, or just be there for you.
Thank you so much.
Yeah, thank you for having us. We appreciate it.
Hi.
Mary Maida at the CCA clearly understates her importance to what we all want to have done, which is cure our dogs from cancers. She's not a volunteer. She's a one-person army to move therapies forward and get better things going for dogs with all sorts of cancers, not even just the ones that I study. She supports lots of cancer work, and she's been a terrific advocate for us. And for those of you that have been in this clinical trial, you know that you get our therapy for no cost. There are costs that the vets incur and charge you for, but it's really through Mary's support that we do any of this. So thank you, Mary.
It's not just me. We have volunteers. Jordan spends a lot of time helping us answering emails and going through research with me. And we have other volunteers too. So if any of you are interested in helping out as a volunteer, especially if you have any background in like doing taxes or as a accounting background, taxes or marketing, and if you like to use social media or other things, please contact us.
Okay. I'm going to try and go fairly quickly through this, although please yell stop or raise your hand or whatever. You know, you can unmute yourself if you have some specific questions, only because I know time is valuable for all of you, and I'd like to get to your questions efficiently as I can. I am both a family of a patient. My own pup passed away about 12 or so years ago now from hemangiosarcoma. So you don't have to, I think about that frequently, and it's motivation for what we do. Again, just to plug Mary's organization, this is her website. Theragen is a company that I started hopefully to ultimately circulate and market and get this therapy out. Hopefully I can't control vet costs or what vets charge, but the goal for me is to make this affordable, one affordable cancer therapy when I know it can be very difficult for some families. So this is our website. I have to say Mary's website is probably more up to date with some new clinical trial sites. I have to work through a third party to change this website. So the latest updates will probably find their way to the Canine Cancer Alliance site before they do to my site. Roughly, sort of generally speaking, this is what's termed in the therapeutic families or the therapeutic strategies as a neoantigen therapy. It means, all that means is a long, confusing word to say it's a part of a tumor protein that triggers an immune response to help attack. This is my pup that passed away. And we learn a lot about these types of therapies from dogs, and they get applied to humans, and vice versa. A lot of what we know about human therapies are beginning to be applied to dogs. I think too frequently dog owners whose pups have cancer feel like dog cancers are easily treatable, and that there should be something that every dog responds to and solves this, as opposed to human therapies, of course, which we know are not always successful. But I can tell you that treating dog cancers are significantly more complicated and difficult than even treating human cancers. And that is in part because the numbers of therapies available to humans just are not yet there for dogs. So we have fewer strategies, fewer therapies to use in our dogs with their cancers as opposed to human cancers. It's just a New York Times Magazine article that emphasizes the fact that animal cancers look almost identical to human cancers in how they grow, how they metastasize, all of the mutations that both dogs and humans have. Some of you probably know that dogs on the lower left, I don't know, can you see my pointer here on the slides? Yeah, okay. Dogs get melanoma, as you probably know, leukemias and lymphomas, breast colon cancer, prostate cancers, bone cancers, osteosarcoma, for example. The frequencies of cancers in dogs differ from those in humans. Dogs, as we typically know, get a much higher frequency of the bone cancers than do humans, although humans do get it. And it is about 100,000 or so new human patients with osteosarcoma arise every year. So you don't have to pay too close attention to this, but I only include it to say that this is a family of proteins that sit on top of the tumor. And I'll explain why in a little bit. These are very important. There are therapies designed for the treatment of human cancers, Herceptin, if some of you know about that, or Erbitux, are immune-based therapies that are successful treatments in many forms of cancers that express these proteins in humans. There are no therapies that resemble this yet in dog cancers, except for ours. And the trick here is to trigger an immune response to these proteins that ultimately attacks and binds to the tumor cells and prevents them from growing. The goal of our therapy is either to keep tumors at bay, keep them from growing, or slow their growth, or at best, of course, clear them or kill off tumor sites in your pups. And we've seen all three. But remember that if the tumor stays the same size that your vet has seen in your pup will do quite well for a long, long period of time. We heard an example of that at the start here. This is kind of a complicated.
Mark,
Yep.
Mark, I just want to mention that you mentioned these human drugs, monoclonal antibody drugs, and those human drugs that target same kind of proteins are extremely expensive, if not tens of thousands of dollars. A lot of immunotherapies are hundreds of thousands of dollars now, which means unless you have insurance coverage or unless you live in the US or, these rich countries, you don't have access to these therapies. So I think Mark is modest. I mean, he wants to help dogs. Of course, we want to cure cancer in all dogs, but also there is an implication for human medicine, especially in third world and all these other countries where they don't have access to cutting edge immunotherapies. Cost-wise, it's out of reach. This may in future have a huge impact. And I know, Mark, I'm not I'm just wanted to that.
No, thank you, Mary. That you can sneak in these comments along the way because yes, I would love to think that we're going to get into humans soon. My hands are a bit full with trying to get us into dogs at the moment, and but we are actually discussing potential human clinical trials with this therapy with another group of people who are very good at doing that. So, who knows? Maybe you'll see this in people in a year or 2 or 5. This is a picture of a tumor cell cartoon, obviously, with all of these different proteins of this family sticking through the cell, and two of them come together, form what's called a dimer, which is 2 of these proteins stick together. And then they get bound by something that, for lack of a better term, tickles them and stimulates the cell to do all sorts of things by some complicated pathways. But the conclusion is in the center of this slide, which is it causes tumor cell proliferation. It helps tumor cells survive. It provokes them to invade other tissues and metastasize. So that's the importance of these. And it's really a dynamic process. Tumor cells will rearrange these family of proteins. Some tumor cells may be rogue and break off and not express any of them, which makes treating some tumor cells, even from the same patient, more difficult. It's one reason why both humans and potentially dogs become resistant to certain therapies like Herceptin or like Erbitux is that the tumor cells want to survive. So they'll do anything to survive and multiply. And if that means losing this family of proteins, that's oftentimes what they will do. There are a bunch of drugs for this family of proteins in humans. You're looking at them now. Cetuximab is another name for Erbitux. Herceptin is the same as trastuzumab. So again, it's a drug, as Mary pointed out, an antibody drug that binds these receptors on the surface of the tumor cell and blocks all of this signaling pathway so that the tumor cell doesn't get the signal to divide and to metastasize. So the strategy of our therapy is to make an immune response with our drug that has the same activities, same biology of these drugs that are successful in humans. So what are the tumors in dogs that have or have been reported to have these types of tumor proteins? And the list is here. As you can see, that the tumors in bold at the top are the ones that we are presently studying in our clinical trial: osteosarcoma, hemangiosarcoma, and bladder cancer, or also called transitional cell carcinoma. But there are a vast number of other dog tumors that express these receptors on their surface as well. And this isn't even honestly a complete list. So this is what our trial is. It's 2 injections under the skin of this formulation that we've come up with. And that complicated looking group of cells in the middle are cells that actually come and nibble the vaccine where it's injected and travel back to lymph nodes and start to make immune responses, hopefully to travel to the site of the tumor and bind those receptors like EGFR and either kill the tumor or prevent it from growing. So it's really as simple as that. Very simple strategy. And obviously simple to administer. It doesn't take, hours of IV therapy like human monoclonal antibody therapies do, and it doesn't have the expense of those either. Dogs will make an immune response to this immunization, and it varies between dogs. And this is not uncommon. Humans that get vaccinated, even with the same vaccine, and you can pick your vaccine of choice, flu vaccine or COVID or any other vaccine, because of the genetics in you, you will make a slightly different response than your neighbor or even another family member. And such is the case in dogs. All of these dogs make a positive immune response. I only bring it up to say that we don't yet know how the magnitude or the levels of an immune response may affect the clinical outcome in our therapy. We've had dogs that have what we would consider fairly low immune responses do very, very well. And conversely, we've had dogs that, at least in the laboratory, have very high levels of an immune response that don't do well. So we're trying to understand that. And part of the answer is that, just like in human cancers, the ability or the features of responding to a therapy are controlled probably more by the tumor itself than the therapy. So for example, like I was saying, if the tumor mutates or if it loses those receptors or any number of things, if it changes to avoid immune responses, that's all because the tumor, unfortunately, is smarter than the therapy. So how do we do? I kind of hesitate to show slides like this, but we do get some objective, really good outcomes. This is an example in osteosarcoma. As many of you probably know, the primary cause of morbidity and mortality in osteosarcoma are metastases to the lung that originate from typically, the long bones of the legs. But it really is the metastases that cause, problems in the dogs. These are 4 examples, 3 shown here, of lesions that are growing in the lung that anywhere from 3 to 8 months after our therapy. These dogs have all had amputation, except for the one on the bottom, and chemotherapy along with our therapy. But this is quite unique and unusual and hasn't really been reported much in the literature, the medical literature. The two panels at the bottom are showing what's even more unusual, which is a primary bone osteosarcoma. I'm circling it with my pointer now. That's panels G and H. That now, after 546 days, it's remained gone from this dog. So that's a fairly new finding from our recent clinical trials, but again, very unusual. We have a unique clinical trial ongoing only at Washington State University. Some of you were interested in knowing how our therapy does when your dog cannot get amputation, but for various reasons, either size or other comorbidities, other issues with the dog. And this is one example of that illustrates that radiation therapy, no chemotherapy in any of these groups, just radiation of the bone with the osteosarcoma tumor on it, with or without our EGFR therapy. With therapy is shown at the top. Mean survival is almost, so 50% of the dogs survive a year. Many are long-term survivors, now up to 2 years or so. Without EGFR therapy, by contrast, the survival is significantly less, only 136 days. So again, illustrating that, sometimes combination therapies do work better, and I'll come back to that point in a minute. So this is a group of dogs with osteosarcoma. All of them had what were thought to be clear lungs at the start of our trial. They all got amputation and chemotherapy, typically carboplatin, and all of them also got our EGFR therapy. Now, sort of the thought among the veterinary oncologists is that really almost all dogs with osteosarcoma do have lung mets. They may be too small to see by imaging, for example, X-rays or other imaging technologies. They're just too small to see, but they're there. And that is borne out by the data suggesting that, when the dogs end up getting mets in the lung. So this shows essentially that about half of our patients do get mets. And as you might predict, they don't do quite as well. Half of them live about 229 days. But the important thing here is that our therapy has prevented metastases, or at least objective metastases that you can see by X-ray, in about half the dogs. So we consider that a real, that's a terrific outcome. And that half of the dogs are surviving more than a year and a half or so. And then, of course, many other long-term survivors, because this graph doesn't go down to 0. We know that the antibodies find their way to the osteosarcoma sites. The green color in the two right panels illustrate that. The one on the upper right panel is a real dog tumor that is what we call stained, or we float serum antibodies from one of our patients on top of that tumor. And the fact that it binds means that this family of proteins is present on the osteosarcoma tumor, and that hopefully it's preventing all of those growth factors that I described earlier. Let's move to hemangiosarcoma. This is treating so-called stage 1, which is localized disease in hemangiosarcoma. All of the dogs had gotten splenectomy, and then the two different colored graphs are dogs that either get splenectomy, chemotherapy, and our EGFR therapy, or those that do not. The ones that get our EGFR our therapy are shown in red here, with survival time of about 236 days. That's terrific, because hemangiosarcoma is honestly, as we all know, I think one of the more difficult and aggressive tumors that dogs can get. Dogs that have splenectomy and chemotherapy without EGFR therapy only survive about 3 months. And again, this illustrates that the immune response does find its way to the hemangiosarcoma tissue. This is one tissue that we were lucky enough to get from a dog with hemangiosarcoma that had already had our therapy, had been vaccinated with our therapy, and then it later had a splenectomy, had its spleen removed. We were lucky enough to get some of that tissue. So this is just showing that in the living dog, the immune response, the antibodies that were generated by our therapy found their way to the tumor. So again, all a good sign for preventing growth. I'm only going to briefly mention, related to hemangiosarcoma, we have a separate clinical trial going on only in Seattle at the bridge at BARC, the Dr. Chelsea Tripp. Gilvetmab is being provided by the company Merck. It is a checkpoint inhibitor. This has really changed the landscape of treating human cancers. We know less about it in treating dog cancers, but some of our studies hopefully will elucidate or try to illustrate how combined therapies like Gilvetmab and our therapy together may do better than either therapy alone. So this is a trial that, again, is only for hemangiosarcoma, and it hasn't been going on that long, less than a year, actually. So we're kind of new into that. I don't have yet any data for dogs being treated this way, but should you care to enroll in this trial and hopefully live close to in the northwest, I'm sorry, near Seattle, that would make it significantly easier. The real pleasure of doing this work is seeing dogs do well. All of these have done well in over the years that we've been doing this. So this is honestly what lets me smile and sleep at night. So,
behold, the single most perfect thing I have ever seen in my entire life.
the dog on the right had osteosarcoma in 2 legs, had both of them obviously taken off, and had gotten our therapy, and survived about 4 years or so after diagnosis with osteosarcoma in 2 different legs. So kind of a, and then the rest of these dogs are also important to our studies and have elucidated a lot of what we know about treating these diseases. So with that, this is just to remind me that combination therapy probably works best. I'm not going to try and claim that to only use our therapy, avoid chemotherapies, avoid surgery. It's not, that is just not the case. As proven in human cancers and now in many dog cancers, combination therapies are almost always better than single therapy strategies. There is a Facebook page that I'm sure many of you are a part of. It was started by one of our patients. I don't manage the content. I do weigh in on occasion when there are questions or when there's factual information that may either be incorrect or require explanation. So here's one of the take-home messages that I'd like to illustrate today, is that these are very complicated diseases to treat in dogs. The veterinary oncologists, the board certified ones, are best positioned to treat your dogs. And then the other thing is that I don't pre-qualify or enroll patients in our own clinical trials. That would be unethical. And I let all of the sites, they all manage our clinical trial under the same guidelines, but they do that all on their own. So I have many clinical trial sites to thank all over the country. Unfortunately, we're not in some of the major urban areas. We're not in Florida yet, or we're not in Texas. And I apologize if you're from there. And I know that many of you drive long distances to find us. Originally, our clinical trial was only in the state only in Washington State. And when I found out there were people driving many, many hours to get there, that's how I couldn't sleep at night. So I requested more sites from the USDA, and in fact, they granted that. So we're at least in a number of other sites: Chicago, Cleveland, Cincinnati, Pittsburgh, let's see, Salt Lake City, Phoenix. We have a new site open in the Los Angeles area, and 2 in Virginia, 1 in Connecticut. Again, many thanks to many people, notably the Canine Cancer Alliance, for supporting this stuff. I will quit there and take questions if there are any.
Thank you so much, Mark. So we had some questions from the chat room and also mailed in. So I'm going to start with the ones that were mailed in. Let's see. Okay. For dogs who are unable to get amputation, but who has had radiation instead, is the EGFR HER2 vaccine just as effective as those dogs who have been amputated?
That's a difficult question. I did show you the data from Washington State University. Those are all dogs that only got treated with radiation with or without our therapy. And as the data showed, the dogs that had radiation with our therapy did better than those that only had radiation. But again, it's a complicated thing because the tumors really are very different from dog to dog. Some dogs respond differently to radiation.
I think your earlier data had about 65% survival for dogs who had amputation and chemo. So 65% is higher than 50%, even though it's small numbers for the dogs who just got radiation and the vaccine. But if you subtract chemo, I wonder what that number is. I guess.
Subtract chemo from those that had amputation.
Yeah, amputation, chemo plus vaccine, but subtract chemo, then
we do have some of that data. I'm a little hesitant to share it, in part because I don't want families necessarily to decide about therapy for their dogs without the sound advice from a veterinary oncologist. And I'm certain that most oncologists would encourage chemotherapy with or without our therapy and surgery. So I'm not here to put surgical oncologists out of business, but I think time and having more numbers of patients in our clinical trial that are in those groups that don't get amputation or don't get chemotherapy, say amputation, no chemotherapy in but our EGFR therapy, those will emerge, and hopefully they'll do better than a single agent therapy alone.
Thank you. When is the timing of booster? What is the ideal time for the booster shot?
Great question. We do know that a bit like COVID vaccination, where levels of immune response start to drop off about 10 or 12 months after the initial immunization. Such is the case with our therapy. We tend to recommend a booster at anywhere between like 10 or 12 months, sometimes earlier. Again, that can be solved, or we can know that by having a blood sample to measure immune responses and tracking when they begin to drop, and then providing a booster. Again, the genetics of the dog make a big difference, just as I was describing earlier, is that Some dogs will maintain a very good immune response, better than other dogs.
Do the oncologists know when the next booster is going to be? So after about 10 to 12 months,
Yes.
after that, is there another booster? Yeah.
So we now have dogs that are surviving, not only a year, which they get boosted, but even 2 or 3 years. So they've had even subsequent boosts. I forgot to mention the one side effect, at least. I don't consider it significant, but about 20% of dogs, maybe some of you in this group, and I'd love to hear from you, get a lump or even something more significant than that at the site of the injection. It's called a sterile abscess. It's not an infection. It's not tumor. The vaccine is perfectly sterile, but it's more like in human vaccinations, when your arm gets sore after an injection, that's actually a very good thing. It means immune cells and inflammation are happening at the site of the injection. Dogs have a little bit more severe response. It's not painful to the dogs, though. Most of the owners can, touch it and palpate it, and warm compresses help it go away in about 10 days or so, usually.
Great. Stephanie wrote that her dog, Traeger, who's 9.5 years old, received his first booster shot, and he's doing great. No side effects. He did not have surgery. His lungs are still clear. And her question is, well, how many dogs are in the study?
That's a bit of a moving target because every week more dogs enroll. We have probably, between the 3 different cancer types, bladder cancer, hemangiosarcoma, and osteo, probably 300 or more dogs in the study in the last 2 years.
Nice. And do you have any idea if how many dogs have made it to their 1-year booster point?
How many dogs? I could pull up that data. I can't do it immediately. I guess the quick and easy answer to that is more than half the dogs live 1 year. So if you have 100 dogs or 200 dogs with osteosarcoma in our clinical trial, 120 out of the 200 will live more than a year. Will do, and then the 2-year survival is, I believe, up around 35 or 40%. Don't quote me on this, please. But this is compared to what's have been published in the literature. Dogs with osteosarcoma, often only about, I think, 15% of them will survive 2 years.
Heather asks, can you say something about subcutaneous or cutaneous hemangiosarcoma?
We have fewer patients in that group. So I can't tell you with enough numbers of those patients that we've treated to give you an idea of how we do there. Unfortunately, it's a less frequent hemangiosarcoma. So I honestly can't give you the information there.
How would a dog with IBD react to the vaccine?
Shouldn't be affected.
Shouldn't be
Inflammatory
affected.
bowel disease, I assume.
Yes. So it's okay.
Yeah, it should be fine.
But you still want the dogs to avoid steroids and certain other immune suppressant
Yeah, there are
drugs.
certain chemotherapies and high-dose steroids that prevent immune responses from happening efficiently, both in humans and in dogs. So those you can speak to the vet that's administering these types of therapies. They will frequently email me to ask if a certain chemotherapy is allowed to be, not allowed, but is compatible. Excuse me, is compatible with our therapy.
Is there an option for a vaccine for glioma yet?
It could potentially be ours. Glioma, at least in humans, does express this form of tumor protein. Again, we've not treated any as of yet. It's a much more rare cancer in dogs.
Let's see, anyone who's asking if their dog is a candidate, please go to the website, which I added to the chat room, and that has a list of clinics, and you'll have to ask the clinics directly if your dog qualifies. Someone asked, can a clinic get started or be involved in Kansas City area?
Would love to. Gosh, let's see. Kansas City would be closest, I suppose, to Chicago. You know, we hope to get USDA licensing soon that will allow us to be in your neighborhood, honestly. I have a meeting with the USDA next week. It is all in their lap to approve or not our therapy. It's, as you pointed out earlier, a complicated and long process. It's difficult, but I'm here till the end. I'm going to grind it out and get us out there.
Oh, you're a hero. You're our hero.
I can scroll through some of these questions that are posted if that's what you're doing.
Okay. Yeah.
NF showed a beautiful picture of his dog getting vaccinated yesterday. It looks like our Connecticut site. They have a mobile veterinary unit. It's in a large van actually, but it's state of the art. They can do anything that a bricks and mortar office can do. What percent of dogs with HSA who get the vaccine are reaching the 1-year survival benchmark? Actually, a lot more than that. Was data that surprised me a great deal. Actually, I showed that today. It is, I can get you the exact number off of our data plot. 36. About, let's see, the mean survival. So about 30 or 40% of dogs make it past a year with stage 1 hemangiosarcoma.
Someone was asking about the definition of stage 1. Stage 1
okay.
usually means unruptured.
Yeah, stage 1 is localized disease. Stage 2 is, as it sounds, a bit more invasive, has gotten into the subcutaneous tissue that surrounds the primary site. And then stage 3 is extensive disease with metastases elsewhere, like the liver, for example. Our therapy does not do much for treating stage 3 disease. It's unfortunately the disease, it's a very aggressive cancer, as you know, as we all know, and we don't do very well with stage 3 disease. And the problem with hemangiosarcoma, it's such, and my own dog passed away from it. You know, the dogs don't express pain much or easily. I think we all have experienced that. It's simple to see with osteosarcoma, a lump forms in the leg, they start limping, you take them to their vet, and you can oftentimes catch it early enough. That's not frequently the case with hemangiosarcoma. Is they'll have a tumor growing, they may have some changes in appetite or activity, but nothing that you may necessarily be concerned about. So it's a lot more difficult with that. In addition to that type of cancer being very aggressive. Let's see. Some people talking about the abscess. Some of them get to be the size of a golf ball. Yes, we know that. Warm compresses. A lot of people use those hand warmers that use in the winter time. Those make great warm compresses. If they start to leak, you know, if the site will open up and leak a sticky fluid. Somebody sent me a link to an Amazon site that has like a compression neck wrap that will that you can put on the dog, or t-shirts, and you know, cinch them up underneath to collect some of the fluid. Honestly, we've never had issues with infection. unless the dog scratches it, for example. But they're typically, they typically resolve pretty good.
Hey, Mark, I was wondering, maybe could you show the Kaplan-Meier survival curve for your hemangiosarcoma? Maybe people didn't have a chance to look at it. Because a number of people are asking about 1 year survival, and you can see it
Okay,
in that chart.
actually, whoops, I need to share my screen again.
Can our oncologists get the vaccine and administer it? The answer is has to be at one of the clinics that's participating in the trial.
That's correct. Can you see this, I assume, now?
Yeah.
So this
Yeah.
is stage 1 hemangiosarcoma. The plot in red are dogs that were treated with surgery, chemotherapy, and EGFR in red. So again, the survival time is about 236 days. That's really pretty good.
So it plots the number of dogs or percentage of dogs surviving over time. So you draw a line from 50 and you can, where it intersects is
Right.
survival time.
So you can see about 20 or 25% of dogs have lived 600 plus days, are still surviving, obviously. And that's the end of the red curve there.
And about 40% of dogs are surviving a year, about a year.
40%, let's see, would be about right here. They're surviving as long as almost 500 days.
And then stage 2 chart?
I didn't put that in this.
Oh, okay.
It's pretty good. It's almost identical to this, which I honestly was surprised about. So it was pretty good. It was only the stage 3 that we didn't do so well compared to standard of care.
Yeah. Would splenectomy pre-rupture, but with LVI, be considered stage 2 as opposed to stage 1?
Yes. Oh, pre-rupture. It has to do with where they see it on imaging. If they see it sort of starting to invade the subcutaneous, the tissue outside the spleen itself.
Okay.
Is doxorubicin compatible with therapy? Yes. Carboplatin and doxorubicin are compatible. Again, high dose steroids are not. Some other therapies are so-called cytotoxic therapies are not, but that would be something to ask me specifically, or ask your vet specifically.
Okay. What is the quality of life like with this treatment?
The side effects, there are no reported changes, at least due to the vaccine, in appetite or energy or other activities. So, unless there's clinical progression of disease, there should not be any quality of life issue. I see one that's asking if there are additional locations for the vaccine, like in California. Yes, Los Angeles just opened up. Actually, Ventura, which is just outside of Los Angeles. And I think that's listed on your site, Mary?
Yes, we updated it. Yep, it's updated. Okay.
Yes, the Richmond, Virginia site will probably be back up and running because the primary veterinary oncologist was away on paternity leave. So I think that should be getting back up to speed.
Okay. Can you talk about research being done on gut health in the vaccine?
Oh, that's very new and exciting. Some of you may appreciate that the bacteria in our gut control how we live in bigger ways than we previously appreciated, both in getting all sorts of diseases like cancer, autoimmune diseases, even heart disease. And that is a study that's ongoing, again, with the Canine Cancer Alliance support in trying to identify if certain families of bacteria in the gut predispose some patients to better outcomes or worse outcomes. And that has been shown in a number of human cancers. And we're trying to translate this into having an idea, honestly, of whether we would have a good idea of whether a dog will respond well or not. Everyone wants to know how good is my dog going to respond. There are a couple ways to do that. And we'd like to know before anything happens, of course, early on. There are potentially ways to take blood samples that show things like level of tumor DNA, for example, that exist in the blood, both of humans or dogs, or identifying features of the gut bacteria that correlate with good outcomes.
And I think just taking probiotics might not be enough that, but with human trials, they've had successes with fecal transplants. And so in future, we hope to do a study to see if fecal transplant tablets might help dogs respond. You can buy them from a number of companies now for dogs.
There's a question about posting a site where you can get information how to join the trial for this vaccine. Again, it's on Mary's Canine Cancer Alliance website. That's the best place to get it, honestly.
You can just email me and I can give you the link to, let's see, any data specifically for dogs that have been diagnosed with subcutaneous hemangio.
No, honestly, we don't have enough dogs that we've treated with subcutaneous. I don't know why they either don't show up at the clinical trial sites, or I don't know. We just don't have enough dogs. A couple people love the mobile veterinary van in Connecticut. And a couple pictures of that, which are interesting. I'm sorry, I have a cough today. Can our oncologists administer our therapy if we pay for the vaccine versus the clinical trial? Unfortunately not at this point. We can only provide it at no charge to the veterinarians that are participating in our clinical trial. When USDA licensing, I keep mentioning that. It's sort of been the pebble in my shoe, is getting the USDA to approve our therapy, in spite of a lot of the data I've forwarded to them. But they're a careful group, and they want to make sure appropriately regulated vaccines or other therapies hit the market at the right time.
Okay. Karen asks that she's hearing that much younger dogs are being diagnosed with cancers, especially osteo and hemangio. Are you seeing this, and why do you think it's happening?
Yeah,
What are your thoughts about screening? Yeah.
We've had dogs 1+ years of age with osteosarcoma or hemangio. A minority, certainly, but no, they do show up. It's heartbreaking, honestly. And again, we're victims of our genetics in a way, both in humans and in dogs. Some of the traits that lead to things like cancer or other diseases, heart disease or autoimmune disease, we're victims of our, genetics.
Yeah. With human patients, there has been younger patients being diagnosed with cancer. They can clearly see that, except for dogs, there isn't any data like that. And PetDx ran a big survey data, and they broke it down by what age different breed dogs are diagnosed with cancer. If that's repeated periodically, then we'll definitely be able to see the trend, which would be interesting.
I'm reading a question about which type of therapy, metronomic chemotherapy, that's low dose continuous therapy, immunocytin or PhytoCure. Now, PhytoCure is not a therapy. It is a company that defines genetics from your dog's cancers and recommends particular chemotherapies based on what they find, mutations, for example. So PhytoCure is not a therapy. It's a laboratory analysis of your dog's tumor. Immunocytin for our present clinical trials is not allowed, unfortunately. it's another non-specific immune-based therapy. It kind of revs up the immune system. So unfortunately, people interested in our trial, if they've had that, cannot be enrolled. Cardiac HSA, a lot of hemangiosarcoma questions. My own dog passed from a cardiac hemangiosarcoma. Has there been any luck for cardiac with vaccine or splenic? We have a few, but not enough cardiac HSA patients in our trial to address that with certainty. Melissa Miller in Richmond is amazing. I agree. We travel any distance. I don't know where you traveled from, but yeah. You know, every clinical trial site we have is managed by a board certified veterinary oncologist. And they're all part of our trial because they're enthusiastic, forward thinking, cutting edge veterinary oncologists. They want better therapies than what they presently have for their cancer patients. They are all terrific, and you know, you won't be disappointed anywhere you go. But it's very nice to see, you know, a big part of, you know, treating our pups is being just like in human. You know, if you go to your doctor and he makes you feel good and confident and gives you something you can believe truthfully, that's all people want. And the host of vets that are part of our clinical trial are all just caring, thoughtful. They will spend time with you to answer any question.
Should we wrap it up, Mark?
I'm here to, you know, if anybody else has questions. Somebody asked if Yale vaccine in May or June, developed a small lung med in September. Does that mean the vaccine didn't work for him? Could it still be providing some benefit? The answer is yes. Remember, our goal is to slow cancer growth or to stop it, at best to eliminate it. But any of those three are wins for us and for therapy.
Okay, Karen asks about screening, annual screening. Do you recommend annual screening for dogs that are getting older?
Oh, that don't have cancer at all?
Right. And what kind of screening? Yeah.
You know, we all have different thresholds for that. I have a 12-year-old golden retriever. We all know that that breed and that age are particularly prone to cancers. And I have to say with all honesty, my 12-year-old had appetite issues about 6 months ago, and I'm obviously thinking the worst. So I went in to have ultrasound done. Turns out he was fine, and he's thriving and doing well and better now. He's acting like a 12-year-old dog, though. He's slowed down and all of those things. But I'm pretty proactive about paying attention to, I think we all know when our dogs are acting a little differently. It doesn't mean it's cancer necessarily. But for a 12-year-old dog, the statistics are not on his side, in that about 1 in 2 dogs that are 10 years or older will ultimately end up with a cancer of some kind. That's just what the data shows. Overall, about 1 in 4 dogs will get cancer in total. A few other fun facts that you can talk about at cocktail parties. There are 90 million dogs in this country. There are 60 million families, obviously many of them on this call, that have dogs. That means some families have more than one. There are more dogs in this country than children under the age of 18. There are more dogs in this country than hogs, than pigs. There are more dogs than cows. So, you know, they're worth taking care of, I guess, is the take-home message here.
All right. No, thank you so much. So thank you everybody for joining us. And again, if you would like to be part of this calendar in 2025, please go to our website and upload the picture of your dogs or cats and support Professor Mamula's work.
Thank you all very much for surviving the last hour and 12 minutes.
Thank you, Mark.
Okay.
Okay.
Bye now.
Bye.